all the listeners of Health Education Lecture Series. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408-687-1899. My email address is homeomedicine HOMEOMEDICINE @yahoo.com. Phone number 408-687-1899. Anytime when you're suffering from any disease at any age, please call me for your second opinion. It's a free of cost to discuss your disease on phone. Or even if you are tired of any treatment and you want to get another treatment, scientific homeopathic approach, yes, even then you can call me at 408-687-1899. And even if you do not want to take homeopathic treatment, but you want to discuss your treatment and you do not see any progress in your present treatment, you can discuss with me and I can give you the ideas and I can give you details why this progress is not progressing in your treatment, why it's stuck up. Because I will explain everything according to the nature's process. When there was no medical science, even then the patient persons were suffering from diseases and persons were being cured from the diseases. And that was a natural process, how the nature was curing all these things. So the medical science, the philosophy of medical science has studied all these things in detail, and that has been recorded nowadays, everything. And regarding to that records, I can tell you why there is no progress in your treatment, whatever, wherever you are, whatever treatment you are taking. But if there is a standstill position with no progress, I can guide you the hurdles. What are the hurdles that you are not improving? So, in this way, my phone number is 408-687-1899. And if you are far away from me and you cannot contact me on phone, rather, nowadays phone is all over world. You can contact me on phone. This is my WhatsApp number 408-687-1899. You can contact me from any corner of the world. But even then, if you want to send me a message or you want to send me a message through email, email is homeomedicine, HOMEOMEDICINE @yahoo.com. So you can get your answer through the email as well. My purpose is to just convey the principles of homeopathy or principles of nature, how nature was curing all over the world. And I always request to all of you to cooperate with me, that spread this message to in your community, in your Facebook members, in your YouTube contracts, so that everybody can listen all these things, can get benefited from all these points which I am discussing. It's a type of systematic study I have started. I'm not approaching to any particular type of disease, just like you have seen on the TVs, on the radios. There are various qualified doctors, very good in their practice, very good in their knowledges for their specific subjects. And those are giving their experience lectures on a particular type of disease or a particular type of damages inside the body. But I have started a different type of criteria in these study lectures, that I have started these lectures systematically, how this life was created in the beginning, started from the sperm and the ovum, and how this life progressed, how they are meeting, where they are meeting, and then how they are developing. So all these things I have discussed systematically, one by one, step by step, and the spends in the mother's womb, that is 280 days in a normal way, because all different animals have different time periods they spend in the mother's womb. But the human embryo, or the human fetus, you can say, it spends about 280 days normally in the mother's womb. But sometimes there may be little delay, or there may be little early, within a week or so, the difference we can calculate according to that one. And so I have described all those things in these lectures, that how was the progress, what happened every day, every step of the life when it enters into mother's womb, uterus, and ultimately what happens throughout 280 days, and how this body was formed, and how this body. And nowadays, basically, our subject, basically, why the medical science is required. It is required because there are some problems in the normal go of life, and we have to remove the hurdles of, and we can only remove the hurdles if we know about them. So now the medical science is capable of diagnosing, understanding the diseases not only after the birth, but even before the birth, when the child is inside the mother's womb, that what are the conditions they can suffer from, what are the deficiencies they can suffer from. And previously, it was only possible when the child is born. When the child is born, and we come to know that yes, he is having this type of abnormalities, that is known as anomalies, and that is very late. We cannot do anything for most of the things. We cannot do anything because it's very late, and the child has to spend the whole life handicap or with deficiencies. But now the science has developed many techniques that we are able and to detect the abnormalities in the development of the life and the diseases thereof in the mother's wombs, even at the 15th week of pregnancy, means 3.5 months. Even within 3.5 months, we are able to detect the diseases and abnormality of a developing fetus in the mother's womb. And thereby, now we are also capable of removing most of them in the mother's wombs. Before the child is born, we are taking care of all those diseases. Sometimes with the surgical interventions, and some most of the things are treated by medications. And the medications, as far as medication is concerned, I'm granted that the homeopathic system is the supermost system to treat the human diseases in the mother's wombs, embryos diseases in the mother's womb, because those diseases are two types of those diseases. One, the deficiency diseases. The other one is the genetic diseases. For the genetic diseases, still the hands are up by the medical science. But wherever the deficiencies, diseases, we detect in the mother's wombs and they are developing, and we know that when the child will born with these type of deficiencies, he may die before he born, he may die at the time of birth, or he may die soon after the birth because of those deficiencies. But now, after detecting, because we are now capable of detecting or diagnosing all type of diseases even in the mother's wombs, from the sign and symptoms, by the techniques developed by the medical science, and with the medications, now we are able to cure all those diseases in the mother's womb before the child is born. And in this way, this is the progress of the disease. So these are my lectures. This is what I'm describing, time to time, but not jump upon. No, systematically, everything systematically. When the child was born, before he borns, how he borns, that is the labor. How he born, there's a big chapter. And I have described all the stages of a period of 280 days. And after that, the period is over. Then now the child has to come out of a mother's womb. That's the labor. I have described everything about the labor, the steps of the labors, complications of the labors, and how we can remove those complications, or even how we can detect beforehand These are the complications, just like the pelvic disproportion and all other. There are many other things we can detect before the child is born, so that there should not be a stillbirth anymore. There should not be any dead birth anymore. So all these things we are now capable of saving the life because of the knowledge developed in the medical science. And I am describing in my lectures all those things which were previously beyond our limit. But now these are all under our limits, under limits of the medical science, and medical science is advancing in this side. We are able to save the lives in the mother's womb and in after that. So my lectures were describing all those things and even the complications at the time of labor and after the labor even. What are the complications with the child? What are the complications to the mothers and how we can manage all those things? And after that, we have to detect the abnormality, examination of the newborn. And with the examination of the newborn, I have described everything. What are the abnormalities we have to detect, which are normally known as anomalies, and how we can tackle all those things. There are very difficult type of complications, very you can say the regenerative type of the complications, the metabolic type of complications which a child may suffer after he is born, after it is born. So in this way, we I am discussing all these things with the newborn lives and how we are tackling all those things. Then when a child comes out of mother's womb, he has to face this environment, and he has to face the diseases of this environment. First of all, he was under protection of the mother's cover, and everything was taken care of the mothers. Even then, the deficiency of mothers were proving many of the diseases. But now, solely, this newborn child is facing new food stuff, and all the organs are to develop their skill to digest that new food and to make the requirements of the body out of that food. And also the other complication of the environmental complications, you can say, the child has to suffer because he is coming up in a new environment. Or in this way, I have described step by step all the things related to that periods. And then after that, the diseases mostly how we tackle now. Nowadays medical science is tackling very efficiently all those diseases, just like the polio, tetanus, influenza, many other diseases which were, if not killing the child, they were proving fatally type of damaging the systems of the children, just like the measles, rubella, varicella, mumps. All these things I have described one by one in these lectures systematically, not jumping upon only for a few important things, but describing systematically. So ultimately, the age after the newborn up to 1 years, this newborn was entering into the toddler's age, and the toddler's age was entering into the adolescence age. So all these things I have described systematically, what changes takes place in the different criteria, different phase of the life, and what are the complications at that time, and how we can tackle, how the medical science can tackle with all those things. Ultimately, after the adult age, uh, I have described everything. Then, when a child enters into the adult age, what are the changes between girls and boys? What happens? What are the astonishing incidents happening in this life? So, child is the male is converting into female, female is converting into male. Even the mother's womb and after born, these things were happening and astonishing and surprising things were happening at that time. But now we know why these are happening. Now we are able to understand, we are able to digest those things normally, that this is the normal phase because of the hormonal change, because of the genetic X and Y chromosome study. We know that this can happen because of this, because of genetics. So in this way I have described everything systematically since many months, you can say the years. I'm discussing all these things with you, those who are listening regularly. These lectures. So after that, after entering the adult life, I just came back to discuss the basic units of this life, that is the cell. Then I described about cell. What is a cell? And everything about the cell structure of, inside that and outside that, how the cell is fed by the food we are giving to a body, and how it is digested, and how this cell is giving out their garbage, and everything I have described about these things. And after that, we have described one by one the structural formation of this body, the vertebral column formation of the vertebral column, the brachial plexus, and the shoulder girdle, and also the pelvic girdle, and all these things are different divisions of the body, and head, trunk, and the division of the trunk into chest and abdomen, and all these things systematically, one by one. I'm continually describing with you, so that everybody who is listening regular these lectures should know how this big body has formed, and from where it has started, and if ever there be any problem genetically, any structurally problems, and uh, why it is, what are the reasons behind that, whether it is genetical, whether it is acquired, and how far. So everything I have described in my these lectures. And after that, we started the organs formations, that all the parts, just like the head. What are the organs inside the skull? Mostly, every person knows that there is a skull, there is a brain, there is one brain. That's all. No, it's not. It's a village inside the skull. Just like a village has homes, a village has streets, and every home of the village has their own boundaries. So in this way, I describe all these things to make you easy understanding that there are different organs inside the skull and their functions as well. So after that, we came to the neck, and neck, though it's a junction between the head and the body, and still there are some organs which are locally related to the neck area, and I described about that one, internally, externally, everything. And after that, we came to the chapter of present chapter is going to of the chest. This chest was a part of the trunk. The upper part of the trunk is known as chest. The lower part of the trunk is known as abdomen. And abdomen itself has been divided into two portions from internally. Chest and abdomen, we can see the division outwardly, because the chest is composed of ribs. A cage is made by the ribs and sternum in front and vertebral column in the back side, whereas the abdomen is free from this type of cage. So this was the division. But after that, I told you that abdomen internally has been divided into two portions by the greater sac of omentum, and this coverings of the intestinal organs, peritoneum, and the greater sac and the lesser sac of the peritoneum. These two sacs are dividing inside the abdomen. Outwardly, we see abdomen is one thing, but internally, the abdomen has two sections. So all that I have described you, and I have described the. I'm now in the phase of describing the organs in the different sections. So in the chest areas, when we are still at the chest areas, I have described the main important structures: ribs, sternum, vertebral column, and how this cage is formed, joints of the ribs, intercostal muscles of the ribs. All these things I have described one by one in detail, so that you can understand how this cage is formed, and what are the muscles they are responsible for forming this cage, and how it works. After that, the internal organs. Most of the portion of the internal cage of this rib cage, you can say, is covered by the lungs. There are two lungs, right lung and left lung, and right lung has three lobes, and the left lung has two lobes. Even there is a still smaller lobe, lingula. But after that, I described about the lobes. What are the lobes? What does it mean? And they do not have internal relation with each other. They are separated by their own substance plus the pleura. And the pleura is a covering of all these lungs. Both the lungs are covered by a layer, double layer of the pleura. One layer is known as the visceral layer, the other layer is known as the parietal layer. Parietal layer is the outward layer which is attached with the ribs, and it allows the maximum expansion of the lungs up to that layer, up to the ribs. And there is a visceral layer which is going and separating even the lobes itself inside the right lung and inside the left lung as well. And there is a fluid I have described about that one, that in the pleura there is a fluid which facilitate the movement of the lungs when they expand, when they constrict in the respiration, inspiration and expiration. In both way, the lungs are easily facilitated by this fluid. And if there be any problem, yes, I describe you about the diseases of the lungs, about the pleurisy, dry pleurisy, wet pleurisy, and some other diseases regularly. What are the most important diseases? I just named it. I did not describe yet, but I named it. Ultimately, I will come to the chapter that I will describe the diseases of the body one by one in the different organs. But shortly, I'm giving you the description of diseases, their identification, and outwardly expression, so that outwardly you can understand what this person is suffering from, what type of disease this person is having. So, all these things I am discussing about the lungs side by side. The second thing, the important organ in the chest area, I describe you about the heart. Though the heart is covered in between the area of mediastinum, I describe the mediastinum, that's the middle central portion, about 8 inches wide, and goes back from the sternum to the vertebral column. It divides the chest into three areas: right lung, left lung, and the middle area that is known as the mediastinum. And this mediastinum is a pathway from the neck downward, unites the other organs, and from downward to upward, circulation is going on, lymph channel is going on, food stuff is going on, oxygen, respiratory organs are going on. So they all are passing through this mediastinal area. And also the heart is covered within this area, but most of the part it is covering on the left side. And at that point I described about the situation of the heart, that's known as surface anatomy of the heart. And the surface anatomy of the heart is that you can outwardly, even seeing from the chest, you can see that where a particular valve is situated: aortic valve, pulmonary valve, mitral valve, tricuspid valves, where they are, and the muscles of the heart, and also the covering of the heart, that is pericard. And there is also a fluid in between the pericardial coverings that saves the dilatation and constriction of the heart. There should not be any friction in between that one. So everything systematically, in short, because detail I will give you in my other series of lectures. In short, I'm giving you the importance and structural formation of the organs. So these are the three components of this chest. And in the mediastinum, I told you there are. I divided this mediastinum basically into three portions: an interior portion, a middle portion, and the posterior portions. And just to describe it easy, I told you that if you can cut a upper portion of this mediastinum, all the three sections, interior section, middle section, and posterior sections, means from the chest in front you have make two incisions, just imaginary lines, you can say that one. And you are separating the right lung, you are separating the left lung, and also in between that, the area, the heart area is also in that one, the mediastinum. That portion from front to back up to the vertebral column, if you make that sections, imaginary sections, then you will see there are three portions: anterior, middle, and posterior. And if you cut these three portions, upper few inches portions of that one, then you will see and you can describe it as a superior, superior mediastinum. So superior mediastinum is also covering all the three sections: anterior, middle, and posterior section of the mediastinum, and it has very important structures in that one. Though the whole mediastinum has very important structures, but some of the structures are originating from this area. Also, they are situated in the middle area, and some of the organs goes to the posterior areas. But even then, to make it easy, I describe you that in the superior area, the organs are esophagus, trachea, thymus. And I have described about the thymus, I described about the trachea and esophagus. And after that, I described that in the interior portion of the superior mediastinum, interior portion, that because we have cut the upper portions. Superior portion, there is a thymus again, and that thymus remains active up to the teenage. It has started its life when in the fifth week of intrauterine life, and after that, it was protecting the life as a creator immunity created, and it was saving from the many abnormalities at that life, and that was the thymus gland. But ultimately, as the individual immunity is increased and taking care of the body, when the cells are developed in the whole long bones and all that, they were taking, there is a different long lectures about that one. But when the individual immunity of the person is developed fully at the age of teenage, you could say. Ultimately, this thymus gland is shrinked, and this is just above the head, above the heart. So, in this way, these upper portion has this heart, thymus, and trachea bifurcation. The bifurcation of the trachea means when this trachea is taking care of the respiratory organs, and the respiratory organ, that the larynx, is entering into the tracheal area and and pass through the epiglottis area. It is divided into two portions: right bronchus, left bronchus. And then the right bronchus and left bronchus are entering into the lungs. They come into the anterior portion, they enter into the middle mediastinum, and all this I have already described you about this one. And in this way, there are some heart, there are some blood vessels, just like the aortic blood vessels, just like the arterial, all the arterial sectors are the coronary artery, right coronary artery, left coronary artery, descending aorta, arch of aorta, thoracic descending aorta, abdominal aorta, all these things are going downward. We will describe again about this one. But in the posterior portion, only the esophagus goes back to the vertebral column and to be attached to the stomach in the backside. So, in this way, the vessels, aorta mainly, the major branches of the common carotid arteries, right and left, subclavian veins, I have already described in these lectures. Subclavian vein. What's the importance of that subclavian vein? Sub means under, clavian means clavicle, and left sub, when I say left subclavian, it means left side. So, what's the main importance of that one? I have described you about that one, that because that is bringing all the food stuff digested, ready to be mixed into the blood, and are mixed into the blood at that junction, that is in the subclavian vein. So all the things which are going towards the heart are known as veins. And when the blood is going from the heart to any other organs, even maybe this oxygen blood or this oxygen, without oxygen or with oxygen blood. So this principle is applied, that even the pulmonary artery, we say, the pulmonary artery carries the blood which is deoxygenated, which is not having oxygen, and it's going to take the oxygen from the lungs. So, in this way, anything coming from outward into the heart is considered as the veins, and anything going out of the heart is known as arteries. So, I described about the this subclavian vein, and also the common carotid arteries, and also the superior vena cava is also vena veins, which is coming back to the heart. So superior vena cava, which is bringing blood, used blood from the head area downward to the heart. So in this way, everything was described, and also there was an important another vein which I need to describe again. That was the azygous vein, and I described about the azygous vein, and that's coming from the liver and is supplying the many other things, blood collected from the intestines and also to the right atrium. It goes in that way. So these are all the structures in the mediastinal area. So different sections of the mediastinal area, I describe these things step by step. What are in the interior portion, what are in the middle portion, what are in the posterior portion. But in general, you should know that these all structures are composed up and passing through, because this is a common pathway. This mediastinum is a common pathway which is connecting the head with the body, and all the structures going from upward to downward, from downward to upward, are passing through the middle area. It's a common pathway. So in this way, all these things we have described and to you, and structures entering into the lungs, structure coming out of the lungs, bronchus, thoracic duct, nerves, and everything, and they are passing from the hiling of the lungs, but they are the content of the mediastinum, the middle portion in between the both lungs. So after that, I described about this area of the chest, that is the nerves, vagus nerve mainly, and there are left recurrent nerves, there are phrenic nerve, and all these things I have described one by one, what's their discourse, what they are doing, what they are supplying, okay, what they are taking care of. One by one, I have described in these lectures. And if ever you want to get knowledge again about that one, you can call me at 408-687-1899, or you can go to my previous lecture on YouTube, Homeopathic Natural Medicines, YouTube, by Health Education Lecture Series by Dr. Gurdeep Singh. If you go to the YouTube, Health Education Lecture Series by and Dr. Gurdeep Singh. So in this way, you can get all those knowledges repeatedly. You can listen those and you can set up into your mind. So if you are unable to understand at my first lectures, basically I am repeating time and again. My purpose is not to just cover the syllabus. This is what we were doing in the medical colleges when we were teaching over there. But here my purpose is to convey you the real message so that you can understand it clearly. That is why most of the things I'm repeating time and again, time and again, so that everybody can understand. There are many more new persons are adding to my this program, so they can understand where we are at this time, from where we have started. Just like today, I have given you the Bura from back, from the sperm to ovum, and ultimately up to the present subject we are dealing with. So after that, just let me take a little water. So after that, we were at the level, at the discussion of diseases. that each portion there are diseases, because lungs diseases, when I had discussing about the lungs, I had described about the main important diseases of the lungs, just like the tuberculosis, just like the pneumonia, bronchitis, pleurisy, all these things I have named it, and just given you the important description that if ever a person is suffering from any of this disease, outwardly what you see, outwardly how you can go and recognize that one, that this person is suffering from this kind of disease. So in this way, I will give you the details of that one. That's not the details, you can say that, because every disease will take a complete chapter at a complete time of my programs. Therefore, I am just giving you the indications, the name of the disease, and their particular outwardly indications, so that you can know about that thing, that this person is suffering from this one. So, in this way, I describe about the diseases in my last lectures. Started describing. The first thing I described about the, because mediastinum starts from the neck area, the lower neck area, and at that area there is a thyroid gland, and I have described you about the thyroid gland, what it is, where it is, and what are the common diseases of this one. After that, the trachea was there. There are some problems in the trachea, and people may suffer from that one. So we will be describing all those things. And after that, we have described all the thymus gland and diseases of the thymus gland. Then, in this area, in the mediastinum, there is aneurysm, a main important problem, which sometimes old age people may suffer, which sometimes may be at any age. Any person can suffer from some of. There are different reasons about that one, but that's the aneurysm. I will describe about the aneurysm, what it is, and where it may be, and what are the complications of that one. In short, I will describe here, but after that, I will take up the complete chapter of the aneurysm, because it can happen in any of the artery, in any of the blood vessels. In this way, so after thyroid, I described about the thymus gland. After describing this thymus gland, I described about the aneurysm. After that, metastatic type of tumors in this area, mostly. And then after that, the tuberculosis is also, because the adjoining lungs may have the tuberculosis, and that tuberculosis may affect the mediastinum as well. So in this way, in my yesterday's lectures, I described about the sarcoidosis and mediastinal cancer as well. Then after that, in that area, the mediastinal area, the neurogenic type of tumor, the spinal tumors, and I described about, just for the comparison, and this neurogenic tumors, different type of tumors, neurofibromas, all that one. But here in this area, there is a spinal lesions as well, esophagus diverticulitis as well. So all these things are connected to this mediastinal area in different sections, because I at this time I'm giving you just um, detail of combination of all the areas, but previously I have given you the description that in the interior portion, what are the organs, what are the blood vessels, what are the diseases. In the middle portion, what are the organs, what are the blood vessels, nerves, and the diseases. But because most of the organs are not only in one area of the mediastinum, anterior, middle, and posterior, just like the esophagus. That esophagus is passing through all the areas and going to the backside. In this way, now I am just talking about all the organs which are inside the mediastinal area, maybe anterior, middle, and posterior sides, and their diseases as well. So this was my previous lectures. I have already given you knowledge about in the mediastinums. And now we are starting a phase of diseases, their indications, not in details yet, but most of the significant important. When I will go to the detailed lecture, and then I will give the anatomy, physiological functioning, and then the abnormalities, the diseases of the organs. But here I'm giving you some signs and symptoms of the important diseases, important diseases of the area of mediastinum. So now, as we started, the mediastinum starts from the lower portion of the neck. Then the major important organ at that area is the you can say this thyroid gland. So let's start the thyroid glands. Most of the people now, men's and women's, mostly the females, they all are suffering from the thyroid problems. And the thyroid problem is of two types, mostly. There are many more diseases, not only one disease. But here, importantly, which the most of the people are suffering from the thyroid problem is the hyperthyroidism and the hypothyroidism. Easily understanding that this neck organ, and also covered under the area of the mediastinum, has signs of hyperthyroidism, means first of all we should know that this is the organ which maintains the metabolic rate of our body. And I describe here about the metabolic rate of the body, that it is composed of anabolic rate and catabolic rates. And I described about this one. The anabolic rate means the development of the body, and catabolic rate is the destruction and repair of the bodies. And both these go parallel. And when a child, at the age of the child, is developing, growing, it means the anabolic rate is higher. And ultimately, when it grows to a certain level of age, ultimately a time comes when the catabolic rate is increasing, or they come parallel, and then after that the catabolic rate is decreasing, and catabolic rate is increasing, and we say the person is getting old. In this way, with easy examples, I have told you about that one, that you are earning $5 and you are spending $2. You have saved $3. Ultimately, you will grow. Your wealth will grow. The same way the body will grow. In this way, ultimately, you will become a young man, adult man. And ultimately, a level of age will come, and the level of this metabolic rate will come to a standstill position when the anabolic rate and the catabolic rates are equal. And ultimately, a phase will come when the catabolic rate will increase and the anabolic rate will decrease gradually, and we become old. This is the easy explanation for you to understand. And all these things depends upon the this hyperactivity and hypoactivity of the thyroid gland. So hyperactivity. So today I will take up this hyperactivity first of all, because if you will take up both at the same time, you will be confused. It will be difficult for you to understand that whether it was a sign of hyper or whether it's a sign of hypo. So I will just describe the signs of hyperactivity of the thyroid gland, because we are describing the organs, their diseases, which are situated within the limits of the mediastinum. So if there be hyperactivity, means the hormones produced by the thyroid glands are more active, more in productions, more in activity. So then, another way, the metabolic rate is speed up, excessive speed up than the normal. And we can say all the functions of the body, depending upon the thyroid hormone, which is maintaining the growth of the body, which is concerned with the growth of the body, all the functions are accelerated, then there will be a weight loss, because whatever you eat has been converted into energy, has been gone waste very fast, very fast. And under these conditions, sometimes when you are running very, very fast, you can fall down. You may have an accident. There may be an injury. So, all these things are happening if there is a hyperactivity of the thyroid gland. And the first thing, that you are eating more food, but you are converting into energy and wasting it. Energy is going waste very fast, and there will be a weight loss. The first thing what you see, lean and thin persons with ravenous hungers, excessive appetite, eating now and then, but they are not increasing in muscle mass and not increasing in the body weight. Lean and thin persons. And under those conditions, there is you can say, the tremors of the hand and fingers and all that, because you are running fast. And then outwardly, you will see that there are bulging out of the eyes. Eyes are bulging out, open and wide eyes, larger. It looks like larger eyes. You can see that one. And after that, sometimes you can see swelling around the eyes. You can see swelling and redness. These are the normal indications of the outward. In you can say, when there is a hyperactivity of the thyroid glands. There's also no, you can say, the Graves' disease. Mostly the diagnosis is made by the doctor as a Graves' disease. Wide open eyes, red eyes, seems like protruding eyes, tremors in the fingers, weight loss with excessive appetite, and all these things. Sometimes there is a outwardly development of the goiter. Thyroid gland, when swells up outwardly, that's known as goiter. So that, and the basically the reasons behind that is the iodine deficiencies. So in this way, the goiter we can detect in a person's. And then the main important, the outwardly visible signs, how, just like I told you about that one, the open eyes, protruding eyes, there is a excessive sweating. Normal persons, thin person, having excessive sweating, sweating all over, sweating from the palms, sweating from the soles of the feet, and hair loss, thinning of the hairs. Mostly the ladies normally complains about the thinning of the hairs. The hair, there is a big hair loss on the from the head, not only on the head, but also from the face, eyebrows, and all that. There is a hair loss. Skin is redness, having red patches, coming and going, coming and going. They are not inflammatory. Basically, the redness patches on the skin, they are not inflammatory patches. And there is a hand tremors, swelling, not swelling, the sweating basically. Excessive sweating and sweating from the palms and soles, you can see, with the redness of the skins, and a loss of hair also from the skin as well. Nails, loose hairs, brittling nails. All these things you can see outwardly in a person if you having increased production of the hormones of the thyroid glands, hyperactivity of the thyroid glands. So I told you about the face, skin, swelling, goiter, neck, swelling, eye protruded. These are the important hyperactivity of the thyroid gland. So today I would like to stop this lecture here, because if I will start telling about the hypoactivity, then you will be confused. You will mix up all these things, and it will be very difficult for you to understand that whether it is a hypo or whether it is a hyper. So today, just keep in mind, I have told you the signs of thyroid gland with hyperactivity of the thyroid glands. People are eating much food, ravenous hunger, excessive hunger, and even then they are losing face. These are the indications of the deficiency of iodine. The iodine is the main diet of the thyroid gland. And when there is a deficiency in your food, it produces hyperactivity. So, in this way, finger tremors, swelling, protruder, not swelling, protruder in the eyes, redness in the eyes, redness of the skin and patches coming and going, tremors in the fingers, enlargement of the glands. Every activity. Suppose if the every activity is hyper, it means the palpitation there will be a palpitation and excessive activity of the nerves, tremors of the fingers and hands. You can see that. So loss of weight, because everything is going waste. Everything is going converted into energy and going out of the body. That's all. If everything is preserved, then there will be weight gain. If you're eating more, there will be weight gain. But if there is a hyperactivity, even after you are taking more food, but still slimming, still weakness, all these things are the indications of the hyperthyroidism. And remember, we are discussing about the organs and their diseases which are situated in the mediastinal area. And the first organ, which is the mediastinum organ, that is the thyroid gland, we have discussed today. So I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Anytime if you are suffering from any disease and you want to discuss with me, it's a free discussion. You can call me anytime on 408 687 1899, and you can be benefited from my 52 years of medical practice, and you can get your idea, you can get your results, you can be helped for the diagnosis of your disease, as well as you will be helped for the treatments if you want to be treated by homeopathic medications, homeopathic way of treatments, because it's a scientific approach to your health. What the Because most of the things we do just to facilitate the functioning of the body, but homeopathic system is to treat what the nature demands, what your body demands, to help the body in their normal functioning, what they demand, and to fulfill that demand, to help to fulfill that demand. And the demand everywhere is fulfilled by the food. And the homeopathic system of treatment, the medicines help you to compensate that from your diet, from the normal diet. Just for example, I can give you one example of that one. Suppose everybody in the family is eating the same food, everybody in the family is living in the same environment, but out of the family member, one family member is having something, some problems. It means something is wrong inside their body with the same food. But homeopathic medicines make you capable of driving the nutrients which are desired by the, or which are lacking by one body, one persons in the same families. So this is helpful, very helpful. Whereas the other system of the treatments, they are forcibly giving you supplements. They are forcibly completing the desires. And whenever those medicines are go out of their functions, and then again the same thing will come up. Whereas this homeopathic medicines, make you capable of deriving all the nutrients, all the requirements, fulfilling all the requirements of the body from your normal diet. Because the other family members, they are taking the same food and not suffering from any problem which you are suffering. Just like the iodine, I told you, the iodine is the diet of the thyroid gland, and we are taking the same food, but other people are not having hyper or hypothyroidism. It means they are assimilating the iodine, normal quantity of the iodine, from the normal diet. The same diet you are taking, it means something is wrong inside your body. Something is wrong inside your body, and homeopathic medicines are dealing with that incorrection, and they are correcting the faults inside your body so that your body can recover, can take the iodine sufficiently from your diet, which the other peoples are taking, but your body was not taking, and now you will be able for that one. So this is what the homeopathic medicines are helping you to be a normal functionally, and your function will be normal, and you will be recovering from the diseases from on your own, by your own way, not forcibly, temporarily, but it will be a permanent cure of your diseases, of your deficiencies, of your abnormalities. So this is Gurdeep Singh Sandhu, your homeopathy consultant. And if ever you want to take help from my knowledge of 52 years, you can call me at 408 687 1899. And second request, always I request from different radio joints with me to deliver this message to the public by their own radios, by their own TVs. And similarly, I'm requesting you always that please, if you get some knowledge from these lectures, convey this message to your nearest and dearest so that they can join me on my Facebook as a friend. They can listen my YouTube channel by joining my YouTube channel Homeopathic Natural Medicines by Dr. Gurdeep Singh, Health Education Lecture Series by Dr. Gurdeep Singh on YouTube, and also you can join the Sabarang radio stations. Sabarang radio station, and also on different days the radio Pravas joins us, and many other radios at different time periods they join us, and so that their public can have this knowledge, and to get knowledge about their body, about their life, about how this body is running, the functioning of this body, and diseases of these bodies. So I'm thankful of all those radio stations who are joining me and conveying this message to the public, their listeners also as well. So good luck for all of you, and we'll see you tomorrow with the Hindi lectures of this. Whatever the knowledge I have given you today, the same thing will be repeated in the Hindi medium, so that the Hindi medium peoples who are listening the Hindi lectures can be knowledgeable about this one. Thank you for all that one, and we'll see you tomorrow. Again, my phone number is 408 687 1899. God bless you all.